Assalamu alaikum wa rahmatullah. In this video, I'm going to explain how to do the scrotal test and the internal ring test. I'm going to speak in English so our fellow non-Arabic students can understand. So the first thing, what's the purpose of the scrotal test? The purpose of the scrotal test is to locate where the inguinal hernia is. So the inguinal hernia could be outside the canal, that's mean it's a bubonoceal, or it could be inguinoscrotal, or it could be scrotal complete. And in the last case, it's gonna be apparent for you. Like the scrotum will be very big, and it's gonna be easy to identify. Okay, I think most of you know that patients with hernia, and it's very important to examine patients with hernia while being standing. You're gonna tell the patients to cuff so you can clearly see the hernia. You're gonna do your general examination of the hernia as any swelling, and then you're gonna move on to do the scrotal and internal ring test. So to do the scrotal test, you're gonna hold the spermatic cord, which is a firm cord. You're gonna hold it from the side of the scrotum right here, and then you're gonna tell the patients to cuff. If you feel the hernia, the impulse of the hernia below you, that's mean the hernia is scrotal or complete hernia. If you feel the impulse on your hands or between your hands, that's mean the hernia is inside the canal. And if you feel the hernia above you or you don't feel the impulse, that's mean the hernia is still not inside the canal. It's bubonoceal. Now, to do the internal ring test, we first need to locate the internal ring. Where is the location of the internal ring? So here, and as most of you know, the internal ring test should be done while the patient is lying down. There's a part where the patient is lying down. There's a part where the patient must stand up. You first tell the patients to lie down in order to locate the internal ring. Now we want to locate. Now we want to use the adductor longus in our advantage. In order to feel the adductor longus ligament, which is here, you're gonna tell the patients to put one leg over the other. Like for example, put this leg over this leg, and then you're gonna slightly push. You're gonna tell him to push with his knee on your arm. You're gonna feel the adductor longus tendon right here. It's a firm tendon. You're gonna feel it on the side, medial side of the thigh. You go with the tendon to the end, and then you're gonna find the pubic tubercle. You're gonna find the pubic tubercle. You're gonna find a bony prominence that's at the end of the adductor longus tendon. That's the pubic tubercle. Now we want to locate the anterior superior iliac spine. There are many ways to locate this bony prominence. One easy way is to go with the iliac crest and find at the end the most upper lateral bony prominence. That's the anterior superior iliac spine. You can also see it yourself. Like you can locate the most superior lateral bony prominence here, and it's going to be the anterior superior iliac spine. Now we want to locate the points that's in between these two bony prominences, which is here. You want to go half an inch above this point, which is the mid-inguinal point, by the way. You want to go half an inch above it, and here, like this, that now you have reached the internal ring. As you see, this is the internal ring on the other side. Now, to make it a standardized test for all of us, despite whether the hernia has entered the canal or not, we're gonna want to reduce the hernia. Now, we know that the inguinal hernia moves downward, forward, and medially. So in order to reduce it, you're gonna go upward, backward, and laterally. That's mean in this direction. The same direction you're gonna move. You're gonna place your thumb here in order to feel the pubic tubercle. The bony prominence of pubic tubercle, and another finger here. You're gonna go with the thumb that's already here and push the hernia with you in order to reduce it. That's mean in order to reduce it and to ensure that the hernia is not inside the canal. That's it has returned back from the internal ring. You can here tell the patients to cuff, and you're gonna feel that the hernia is inside the canal. Now, what you're gonna do here is you're gonna keep putting your thumb right, closing the internal ring, and you're gonna tell the patient to stand up. Remember that you must keep your thumb on the internal ring or it fails. Now, when the patient stands up and your thumb is still closing the internal ring, now you're gonna tell the patient to cough, and then here we have two scenarios. The first scenario after you tell the patients to cough is that you're gonna feel the hernia not coming back. You're gonna feel it on your thumb, and in this case, we're gonna say that the internal ring test is positive. What does positive mean? That positive mean that the internal that's the inguinal hernia is indirect or oblique inguinal hernia. But in the second scenario, where you tell the patients to cough, you're gonna see the hernia coming up. And I just want to point out that in the positive test, in the positive internal inguinal test, when you remove your thumb after you're telling the patient to cough, you feel it on your thumb. There is nothing coming out. You're gonna move your thumb. You're gonna see the hernia returning back. That's to ensure that it's really indirect inguinal hernia. In the second scenario, when you tell the patients to cough and you're still closing the internal ring, you're gonna see the hernia coming back, even though you're still closing the internal ring. The hernia will come back through, as you know, the Hasselbalch triangle. And in this case, the test will be negative. That means the hernia is direct hernia. It's not due to the cause of the inguinal canal, but due to the weakness of the muscles of the abdominal wall. So to revise it quickly, first the spermatic test, the scrotal test. You're gonna hold the spermatic cord here. You're gonna tell the patients to cough. If you feel it below it, it's scrotal or complete, and it's gonna be apparent even without the scrotal test. If you feel it between your arms, it's inguinal scrotal. If it's above or you don't feel it, it's bubonocele. After that, you're gonna locate the internal ring. In order to do the internal ring test, you're gonna make the patients lie down. You're gonna feel the tendon of adductor longus. You're gonna go but first you're gonna, as I said, you're gonna tell the patients to put one leg over the other. You're gonna feel the tendon of adductor longus, go to the end, that's pubic tubercle. You're going to feel anterior superior iliac spine. You're going to go with the iliac wrist. You're going to find the anterior superior iliac spine. And then there is the middle point between them. You're going to go half an inch above it. That's the internal ring. Now you're gonna do what's called reducing of the hernia, upward, backward, and laterally. You're gonna push the hernia back. You're gonna tell the patients to stand up while your thumb is still closing the hernia. And now we have two findings. The first is that the hernia will not come out, and in this case it's positive. To make sure, you tell the patients, you remove your thumb. Of course, you tell the patients to cough. You remove your thumb, you see the hernia returning back. In the second scenario and the second finding, when you tell the patients to cough where your thumb is still on the hernia, you can see the hernia returning back through Hasselbalch triangle, and in this case the test is negative, and the type of the hernia is direct inguinal hernia. Thank you for listening, and good luck in the OSCE exam.